TAG, You're It, Medical and Health's Role in Emergency Response. Episode 1, The Campfire Begins, Introduction.
I was driving to work that morning. I got in my car, drove down the hill just a little ways because I lived higher up in the valley. Driving down the hill, my husband's right in front of me taking my daughter to school. And I pick up my phone and I say, "There's a big plume of smoke there." And he's like, "Yep." My husband's an insurance agent. So we both said, "All right, it's going to be a long day."
So that morning, I was getting to my office in Oroville at right around 7 a.m., which is kind of the way it usually was. I saw a plume of smoke, and there was a brand new assistant public health director who had just started, I think, 2 days earlier, and she was coming in, and I pointed out the smoke, and I said, I think the next couple of weeks of our jobs just changed. I was wrong. It was the next at least couple months, if not couple of years.
So the morning of the fire, I live in Chico and I work in Oroville, which is about a 25-minute commute. Waking up in Chico, I knew there was a fire. We've had several fires before, so I didn't know until I left my house, getting an inkling of how big this one was. But as I was driving to Oroville that morning, it looked cataclysmic. The sky looked like nothing I had ever seen.
On November 8th of 2018, the campfire broke out. And that is like nothing I've ever experienced in my life. It was an absolute sprint, a very, very destructive and fast fire.
The campfire began on the morning of November 8, 2018, from a power transmission line failure and spread rapidly due to high winds, heavy fuels, and low humidity. The first reports of fire near the Poe Creek Dam were received at 6:33 a.m.
I'd like to report a wildfire.
Okay, well.
In the President Canyon area.
Yeah.
Highway 70 above Poe Dam.
Yeah. Yeah, we got another report.
And I just want to give you a heads up, the winds are whipping.
Mass evacuation of the entire community, including medical and healthcare facilities, was an immense undertaking. First responders risked everything to save lives that day while moving medical patients to safety.
I pull over into a parking lot. I send our department operations center group message, and I'm like, "Hey guys, do you see the fire in the hills? What are we doing about it?" Get back in my car, kind of wait for those responses to come in as I get to my office. Jump into my office, turn on the radio to listen to that traffic that was happening. And you could tell, Matt, it was a massive response that was happening right then. The fire was moving very quickly. My first thing was Feather River Hospital's right there. Let's call their emergency manager. So I called Wendy, who was their emergency manager at the time, and I'm like, "Hey, how's it going? Like, does the fire seem like it's close to you?" And I believe she walked right out these doors and said, "Yep, I see more than I should be seeing right now."
By the time I got to work, which was before 8 a.m., we already were getting reports of how fast this fire was spreading and that Paradise was being evacuated.
Our emergency preparedness response manager lost her home, and she took care of her family, and we never saw her. So that person was not available to us for this entire response, and we've never seen that person to this day. But we did see a lot of people in that DOC, and the people that you are in the trenches with for these really exceptional challenges, you will have a bond with them in a way that will surprise you, and a level of trust that goes beyond friendships and our normal levels of trust.
First responders and public employees transitioned quickly to emergency response mode, helping Butte County residents and visitors evacuate swiftly and safely to designated areas outside the danger zone.
Our communication with the RDMHS, which is the Regional Disaster Medical Health Specialist, who was John Lord in Reading for Region 3 at the time, that all went quite well. When I spoke with John Lord at 8:06 in the morning, not only could I give the MOAC approval, I could say, please direct your ambulance strike teams to these 5 or 6 skilled nursing facilities that are in the most dire need.
The Camp Fire, unfortunately, as I mentioned earlier, is kind of a career incident, once in a career incident. And so it was a very large scale incident, a very fast moving wildfire. We did request and utilize a significant number of ambulance strike teams during the event. Unfortunately, at the very early stages, again, getting them into the area from outside the area, the evacuation of some of these individuals defaulted to private vehicles, law enforcement vehicles, fire vehicles, buses, and all that.
Knowing there were shelters, I started getting our nurses ready. We already have go boxes for nurses that are placed in our different health department offices. So we started calling nurses and having them be ready to respond as soon as the EOC requested our participation at the shelters. So we were ready to go, and we knew that we were going to be busy. And just as the fire unrolled, we had constant communication through the EOC to our DOC, through people that we knew, personal calls, our staff who was living here, who were trying to come to work, who were calling in and saying what was happening, people who had already made it to work and thought they had to turn around to try to go up to get their child from school or back to their home. So there was communication immediately.
The Camp Fire was one of the deadliest and most destructive wildfires in California history. 85 lives were lost and nearly 19,000 structures were destroyed. The outcome, however, had the potential to be far more devastating. The swift actions of the emergency response community and first responders undoubtedly saved countless lives. In this video series, you will learn how the local medical and health community leverage existing emergency management response plans and practices to acquire local, regional, state, and federal resources.